Hi, I'm Jocelyn Alt. One of the things I find really sad about the current debate about healthcare reform is that many of the ideas in the Affordable Care Act were ideas that were long supported by Republicans. For example, the exchanges, the Medicaid expansion, these were things that were in Mitt Romney's legislation in Massachusetts when I worked there as well. But many of the Republican proposals are simply to do away with those components of the Affordable Care Act. For example, the Republicans had proposed eliminating the Medicaid expansion. And as I talked about in a previous video, prior to the Affordable Care Act, not all poor people, low-income people, were eligible for Medicaid. Second, the Republicans continue to say that they're going to keep the exclusion on pre-existing condition restrictions. One thing to really be careful of here, though, is that they haven't specified whether they're only going to prohibit insurance companies from just denying people who have pre-existing condition exclusions, or whether they're also, like the Affordable Care Act does, require them to charge the same amount. It wouldn't do much good if they said, well, you can't deny people with pre-existing conditions, but you can charge them whatever you want. In that case, most people with pre-existing conditions would probably be priced out of their insurance. Another Republican idea currently on the table is high-risk pools. The idea behind this is that all the people who have very high risk, meaning are very sick, have serious chronic diseases, will be put in a separate pool. You can see that if the people are put in a separate pool from all of the other people who are healthy or have just minor illnesses, that pool is going to be very expensive. And based on the numbers that the Republicans have provided so far, they're not planning to provide enough funds. So similar to this picture, it would be kind of like diving into an empty pool. And last, one of the Republican proposals is continuous coverage incentives. The Republicans, some of them, appreciate the fact that the individual mandate is important because if people can not have insurance while they're healthy and then have a guaranteed issue, have insurance companies required to provide them a plan, there's nothing to stop people from just signing up for health insurance when they're sick. There has to be some way to incentivize people to have coverage when they're healthy. So rather than having an individual mandate, the Republicans have proposed continuous coverage incentives, which certainly sounds nicer. But what this actually means is one of two things. Either you would have a fine or a penalty if you lost coverage for any period of time, or you might even be denied health insurance after you had lost coverage as a penalty for not having it for that period of time, which is particularly ironic because it would lock out of insurance the very people who might need it most.